Good afternoon, and thank you so much for joining us for this week's Thursday with AARP Wisconsin show. I am Amber Miller, Associate State Director of Community Outreach with AARP Wisconsin, and also your weekly host. Before we get to our guest today, of course, just a few updates. Please visit our AARP Wisconsin webpage for information with regards to upcoming virtual events, information about the COVID vaccine, conversations, all the good stuff that's coming up. Definitely, you can find all of that information at our website. Also, remember the AARP Friendly Voice Initiative, which launched last year. This is a free service to any age. You do not need to be an AARP member, where you can request a phone call from one of our trained volunteers. This could be a daily call, weekly, or monthly call, and it's just to hear a friendly voice on the other end. You can find that information below at the website or call the following phone number, 1-888-281-0145. And also remember, even though right now AARP is not doing any in-person events, there is still a lot of opportunities to volunteer with us. If you're looking to do something virtually, whether it's advocacy, outreach, or presentations, we'd love for you to be part of our volunteer family. If you go to the website below, all information is there along with an online application. And February 17th is the application due date for our next round of funding for Small Dollar Big Impact. This is a small grant program that we launched last year to help communities, organizations, and people with really big ideas that maybe just need a little funding. All of that information, once again, can be found at the AARP Wisconsin website. And just once again, applications for second round funding is due February 17th. So, of course, we're always excited when we have Miss Lisa Lamkins on our show because we know it's going to be all about advocacy. And today it's going to be all about the COVID-19 vaccine. And Lisa, I know yesterday you held TeleTown Hall, and the amount of just questions and the gray areas and how to go about and getting information about the vaccine, I thought it's actually just worked out perfect that you're going to be our guest today. So thank you so much for joining us.
Oh, thank you so much for having me, Amber. I love coming on and chatting with you on Thursdays.
Thank you. And if you are watching this show live, you can submit any questions to Lisa regarding her topic of COVID-19 vaccine on our Facebook.com page or our YouTube page, depending on where you're watching us from. So Lisa, we know that the state is prioritizing the distribution of COVID vaccine to different groups. So we know that AARP advocates on behalf of older Wisconsinites. What is the status of the different priority groups?
Yeah, well, I'm glad you asked, Amber. And I know people are aware that it's been rolling out slowly to various categories of people. The state started with the frontline healthcare workers, people in nursing homes, and then they kind of opened it up to people age 65. In addition to first responders. And all along the way, AARP has been urging the state to prioritize people who are 50 plus. It really follows the science. The CDC said, hey, 95% of those people who have died since this pandemic started have been over the age of 50. So we have pushed, there's a subcommittee working at the state level to make recommendations to the Department of Health Services on who gets to be next. So we have continued to push that group along with the governor and the Department of Health Services to include people age 50 plus in the next round. It's a great first step to get folks age 65 in this category. And we're thrilled that it has been sort of rolling out. And I'll be honest, we heard yesterday that the state is starting to make some good progress on these groups. From what I understand, they're about a third of the way through people in our state who are 65 and older. So I know that still might be frustrating for people who are waiting, but it's better than we were a couple of weeks ago.
Absolutely. And Lisa, for the audience, because of the TeleTown Hall yesterday, is there a way for our audience to view that? Was it recorded or posted anywhere?
It was recorded. We have to wait for the final, like, kind of sound file to
Okay.
get cleaned up and get sent to us, but we will post it at that AARP .org/WI, our AARP Wisconsin webpage. We'll have it posted there. Plus, we had an offer from the Secretary of the Department of Health Services. Her name's Karen Timberlake, and she is willing to do kind of a Q&A. I'm going to send her some questions, and she'll get some answers for us, and we will post those as well.
Great. And what advice would you give to older Wisconsinites who are wondering how to schedule appointments to get their vaccine?
I know this is the big question right now, and I know everybody is super frustrated, and I hate to be the one to say,
Mhm.
try to hang in there, try not to get frustrated. We know, and this is a broken record, we know the whole issue is the supply of the vaccine. We have the capacity in Wisconsin to vaccinate about 300,000 people every week. We are getting about 90,000 doses of the vaccine. So you're probably reading about, your local health system canceling 10,000 appointments, or, the health department that had to cancel 1,500 appointments. And it's just because they don't have the vaccine, and that vaccine comes from the federal government. So here are just a couple of places to start if you have not yet reached out or figured out a place to get the vaccine. The very first place is your health provider, your doctor's office, the health system that you belong to. They are receiving doses of the vaccines. It's nowhere near the amount they want, but they're getting some. So that's the very first place. If you are savvy enough to be online, and if you're watching us on Facebook Live, you are probably savvy enough to be online. It's best to download any kind of MyChart app or any sort of electronic health record app that your health provider has, because the more they can do online, the easier it is for scheduling. If you need to, though, do not be afraid to call. I know they're saying don't call, but if that's the only way you have to reach out, then by all means, reach out to those folks by phone. So first is sort of your doctor's office. Second is your local county health department. Those local departments are serving as kind of connectors. They're sort of helping people who want the vaccine connect with different organizations that might have the vaccine. Some are creating these kind of waiting lists. Some are not. It just depends on the locality. The third thing I will say is they just announced today a new federal pharmacy partnership with Walgreens. So Wisconsin's going to be getting an additional nearly 18,000 doses of vaccines that will be sent directly to Walgreens locations throughout Wisconsin.
Oh.
Again, Walgreens is saying if you can go online to walgreens.com, and then they have a whole Walgreens app as well. If you can schedule an appointment online, that is preferred. Walgreens is in the process of setting up a toll-free number where people will be able to call to make those appointments. Finally, and unfortunately, and AARP has been pushing for this, and I know there is some work at it. We understand there are a lot of people who want this vaccine who can't get online, and there's not a single statewide registration system. We keep hearing that something is coming, although we just don't have any information on that yet.
Yeah, and I know from the TeleTown Hall yesterday, we heard a lot of people stating, access to Wi-Fi or technology has been kind of a hurdle. So it's great to hear that phone numbers will be an option. And then our producer, Darren, just stated we did stream that TeleTown Hall yesterday. So it should be on the AARP Wisconsin Facebook. I 100% recommend you viewing it. It's about an hour long, but a ton of really great information that really goes hand in hand with what Lisa's talking about today. So Lisa, I know we have heard a lot from our AARP members and community members about, do I need to pay for the vaccine? They've heard some people are charging, some people aren't. So do people have to pay for the actual COVID vaccine?
The really good news is this is actually a short and sweet answer. And the answer is no. You do not need to pay out of pocket for the vaccine. But I will say we got some calls from members, and in particular, a member in the La Crosse area who said, hey, this organization wants to charge because they say they can't submit the vaccine to insurance. That's all well and good. It doesn't matter. They still can't charge you for the vaccine, and that was confirmed by our Department of Health Services. Of course, the vaccine is not free, right? Nothing is ever free, but they will be charging insurance. So if you have insurance, please bring your insurance card with you to your vaccine appointment. If you're on Medicare, take your Medicare card. If you have, other health insurance through work or whatever, take that card. If you don't have insurance, do not worry. The vaccine is free regardless. So you don't have to pay for it. The federal government's paying for it. And I will say, I'll give AARP a little bit of kudos here. We were one of the organizations that was really pushing for this at the federal level because we want to make sure that anybody who wants a vaccine can get one.
Yeah, and even my mother asked me if it's free for everyone, and she's almost 65, and I knew that answer because of AARP. So it's also being aware so that you're not scammed, which is really important. So Lisa, I know between the TeleTown Hall yesterday, you're with us today. There's probably going to be a lot more information coming out about the COVID vaccine, and of course, we want our viewers, our members, our non-members to always make sure that they know they can come to us. So what information is coming out from AARP that our members and non-members can take a look at?
Yeah, well, Amber, you kind of teased up one of them, and because we actually know there's a lot of misinformation out there right now. So one of the things AARP is trying to do, as we always try to do, is be that source of sort of good, reliable information. We haven't seen a lot in terms of frauds around the vaccine in Wisconsin, but we hear reports of it in other places, which is one reason why we're trying to get the word out that the vaccine is free. And so if anybody, offers to, put you at the head of a line, if they offer to let you skip a group, or if they offer to get you an appointment right away, and all you have to do is pay them $100, I would assume that is a scam. So, do not fall for that. So we will be getting more information about vaccine frauds and scams out there. And what we're really trying to do is, because right now information is very disjointed, we are trying to create a place where we can put information as soon as we learn about it. So we have a terrific website. It's aarp.org/WI vaccine. And we've got information there on, what are the things you should ask your doctor about the vaccine? Sort of what's the rollout, what's the schedule of the groups who are eligible. And we're doing everything we can to get this website out. We're doing, advertisements on websites. We're doing radio programs. We're doing TV shows. We're sending postcards out to some of our AARP members. The telephone town hall that you mentioned yesterday, Amber, was such a great thing. We actually are talking already about trying to do several more and maybe even smaller ones. So we have a chance to talk to more people and answer more questions. We were flooded with questions yesterday and couldn't even remotely keep up with getting them all online. So we are trying to sort of be that connector. And I will say one of the best sources of information in the state is the Department of Health Services. But if you're not familiar with their website and kind of working through all of that, we have links on our website to them. For example, the Department of Health Services has a weekly newsletter that they send out every Friday that gives some updates on what's going on in the world of vaccines. So we have a link on our aarp.org/WI vaccine. We have a link on that page that links over how to sign up for the COVID vaccine newsletter. So if you're listening in to this, Facebook Live, you're already cued into all of the awesome things that AARP does. And this is just one more way that we're trying to keep our members up to date.
And I know another website, because I was a screener yesterday, so I was actually able to talk to someone of, some of our members about, so I got the vaccine, now what? Do I still need to wear a mask? And there was actually just a slew of questions, not even just about the vaccine, but it's like, now what? So in your opinion, Lisa, is the CDC website or any other websites still something that our members and non-members should be looking into?
Absolutely. The CDC really is sort of I'll maybe say the gold standard of information. It's the best information and the most up-to-date information that the entire country really has. And I will say, just as a follow-up to that, Amber, what we heard yesterday from Wisconsin's Secretary of Health Services was to continue to follow those CDC guidelines. We have these variants that are coming into the state now with the COVID. So masking, social distancing, washing your hands, those things continue to be sort of frontline ways to protect yourself and protect those people around you, protect your family members.
Correct. And I know we're almost coming up to a year of when COVID kind of really was more well known. And it's interesting, all the things that AARP has done over the year. And I definitely know the TeleTown Hall yesterday was just the start of, I think, all the goodness that AARP is going to bring to the community. And, the vaccine website that Lisa talked about, the AARP Wisconsin website, our Facebook page, Twitter page, the CDC website, our viewers, you are not in this alone. You have us here at AARP Wisconsin, and information is updating every day. As Lisa said, just this morning, the information about Walgreens and the vaccines came out. So, Lisa, what advice or any other final comments would you give our viewers if they're just kind of watching this now and they're like, I'm over 65, I still haven't received my vaccine and I don't know where to call, I'm not sure what to do. What advice would you give to them?
I really just have to go back to continue, as frustrating as it is, to be a little patient. We have seen really good progress, in the last couple of weeks, and I think that's only going to continue to get better. If you truly don't know where to go, I would suggest that people start with your doctor's office. And then your second part is go to your county health department. That is their job. And they have been doing an amazing job at trying to get this information out. When people think about things like the vaccine rollout, people are like, well, why? We just have this vaccine. It should just show up everywhere, kind of like the flu shot does, right? I mean, you figure right now, you're like, oh, yeah, I got to get my flu shot. I got to get my flu shot. And you think, oh, I'll get to that. And you don't, people aren't necessarily racing to find that. But that distribution has evolved over a really long time. And unfortunately, we can't use the same channels for the COVID vaccine that we currently have as we do for the flu shots. But it improves, every day and every week, and things are getting better. And so I just encourage people. We know from our poll, we did a poll yesterday on our TeleTown Hall, that most people, at least the folks on our telephone town hall, want to get this vaccine. Like 83% of the folks on the call said they want that vaccine as soon as possible. And so hang in there. I know, the state would like to get as many people vaccinated as soon as possible. And we'll just continue to keep people updated on, where they can go and how things are rolling out.
And as Lisa said too, if you're watching us, that means you do probably have access to technology, Wi-Fi, and a laptop. I encourage you to follow our Facebook page. We're going to update it as much as possible. We're going to have the TeleTown Halls. We're going to have the experts. We're going to have more interviews with Lisa, and really being patient, I think, is key. But definitely we're so excited always, Lisa, to have you on our show. You always bring such really great information. So as always, we appreciate you and thank you so much for joining us today.
Well, thank you for having me.
As always, if you would like to join us next Thursday, we have a really great show coming up. It is all about entrepreneurship in Wisconsin. So we will be having two guests, Nora Schmidt with Starting Black Madison and Nick O'Brien with Sheboygan County Economic Development Corporation. So that show will be next Thursday, February 18th. At noon. And also, of course, I always love to talk about upcoming virtual events. Right now, we know it's winter in Wisconsin, so we might have some extra time to spend on virtual offerings. So February 11th, protecting loved ones from financial scams and fraud. The 16th, AARP Lacrosse Disrupt Aging Book Club. February 16th, the Girlfriend Book Club live discussion of The Invisible Life of Addie LaRue. And then the 20th, if you like Motown music, that would definitely be something to look into. The events can be found at the website below, or please call that 1-877 number. They can give you more information about the events, and you can also register over the phone. And as always, it's always great for you to join us live. If you are not joining us live, please feel free to view this video, but also share it on your Facebook page or YouTube page to share the information that Lisa shared with us today. And as always, we appreciate you, and please be safe, and we will see you next Thursday.